Balancing innovation and responsibility, exploring the ethics of big data use in healthcare.
It's an absolute privilege to open this panel with an ethical panel discussion that holds immense significance in our ever-evolving journey of innovation. So in our today paced world, we witness AI ever-growing impact, particularly in the healthcare sectors. AI reshaping the landscape of healthcare, as we all know. However, the path to innovation must be guided by a strong ethical compass. After all, innovation without ethical innovation can lead us to some certain path. So today we gather all of the brightest mind in the field of health data, AI ethics, and the lawyers. We are here to welcome you, to have you join today. So let's welcome Daniel Torres Gonzalez, partners and health pharma lawyers at Miranda and Association from Portugal. We welcome James Johnston, Head of Population Health Management Analytics at NLS Surrey Healthland, UK. We welcome Vidya Sharma, Clinical Lecturer in Health Informatics at University of Manchester, UK, and Alex Diakonou, CEO and co-founder of IJA Health, USA. So we have really diverse panelists in different regions and different sectors. Over the next 20 minutes, we're a bit late, so just up to 20 minutes, we will dive into the ethical dimension of utilizing big data to drive healthcare innovation. So in the age of ever-expanding healthcare data and AI-driven innovation, we have to strike the right balance between innovation and responsibility. So please, from the first left to right on my side, introduce yourself and share your perspective on why ethics in big data use in healthcare is so critical today, and maybe some challenge do you foresee to maintain this balance? Daniel first, please.
Can you hear me? Yeah. So really nice to be here. Thank you for the introduction. My name is Daniel Torres Gonçalves. I'm a lawyer, and it's a pleasure to discuss ethics. I was in the National Board of Bioethics in Portugal as well, so it's always a pleasure to discuss these matters, and really good to share the panel with my colleagues. Well, big data, utilization of LLMs, AI, of course, bring a set of challenges concerning ethics, and of course we will speak about some of them, namely about privacy, about use of data, how we get the data, how we can use the data. However, in this first question, I would like to address a different perspective of things. That is the core of the relationship between the patient and the doctor. Ethics should start there, and notwithstanding the fact that AI can bring a lot of help diagnosing, defining the treatment for the patient, the fact is that we cannot dehumanize the relationship between doctor and patient. And I think this thought should be in everyone's mind since the very beginning of the development of any technology. Because in the end of the day, it's crucial that the ethic principles of these relationships, so the respect of autonomy, the beneficence, the non-maleficence, the justice, the four core values of medical ethics should be defended by the doctor itself. So we have to have the human side on this relationship and never forget that. And on a law insight, in the EU, we have several situations in which we are protected against automated decisions. This happens with GDPR, and this happens with consumer law in other cases. And this is certainly an issue in which we should be protected against automated decisions, and that starts by having the very nature of the doctor-patient relationship assured.
It's quite interesting to see a lawyer put the human side of the relationship first, so it's great. What's your viewpoint, James?
Thank you. Okay, so I'm Jane Johnston. I'm been running the head of population health analytics in the Surrey region of the UK for the NHS. I'm an independent consultant, so I've worked up in Gloucester and Somerset and Dorset, lots of the southwest areas, delivering population health. I've been in analytics in the healthcare for 30 years, and things are now going towards the population health side. So with the big data, more and more, obviously in the UK, we're fortunate that we have a position where everybody has an NHS number, and we can link huge data sets with all sorts of information and get linked longitudinal records. To me, population health is vital if we want to be able to... The systems are under a lot of pressure, and we're very much used to treating conditions, case management, interventions for people that are already ill. We need to start using this big data to do much more in the world of predictive analytics, using the AI to find the cases and the prevention side, stop the people from getting sick. It's not just about treating those that are already sick and stopping them from going into hospital. It's let's start looking at the health of the nation. The issue is, of course, that the more data we get together, and in the world we live in, everybody's frightened that Alexa can hear everything they say and that's writing their shopping list for them. So it's as you say, keeping the population, the patients, the citizens updated, keeping very transparent. What are we doing with this data? Why are we doing with this data? And it's not just, it's alleviating the fears of what will happen if we let you have this data. It's what the outcome if we don't have this data. We're doing it for your good. We're doing it for your health, for the betterment of your lives. So it's that transparency, and it's being very clear with people why we're using the data to drive forward that population health way of doing things and moving towards the predictive analytics.
Yeah, so Daniel touched on the individual relationship. You go to the macro level of population health. How about you?
Thank you. Thanks, Wee. Thank you very much for inviting me. Good morning, everyone. I'm Valletta. I am a doctor by background. I'm originally from the Netherlands, but I'm currently based in Manchester, where I am the clinical innovation lead at a health technology institute. I really enjoyed hearing Daniel talk about the 4 ethical principles that underpin medical practice. I think these are absolutely fundamental when we think about how we want to introduce new innovation, particularly when it comes to sensitive personal data in healthcare. Specifically, when I think about working as a clinician, I want to have access to data to be able to deliver direct care, and I think that's a distinction that we'll have to make during the course of this panel, is what is the purpose of the use of that specific piece of information or data. And you will have often heard the phrase, data saves lives, and the build-up on that people talk about, data sharing saves lives. And I think all of that is certainly true when it comes to delivering direct care, and I think there are very few people that are against the principle of sharing data, providing access to data to healthcare professionals to be able to deliver direct care. Taking that to the next step and thinking about, okay, if we are capturing or gathering data at scale across healthcare systems, and we're now thinking about reusing that data, not for direct care, but for secondary use, I think there are, again, different layers that people will feel increasingly or less comfortable with. So even if I think about myself, this is a personal perspective, if I was given the option, would you like to share your data for research? Most individuals that we speak to, we did a large market survey of 2,000 members of the public. Most people will say, if it is for research, yes, I'm happy for that data to be shared. if you take that a step further and say, well, how would you feel about this data being used for commercial purposes? That's, I think, where the balance slightly starts to shift. And I think that very much stems, and this is a nuanced view, of course, that balance really shifts between perception that my data or an individual's data is potentially creating value that is not returned to me or returned to society. So I think if we are able to communicate, or be able to phrase the information that we share with our customers, consumers, patients in a way, and indeed think of ethical innovation that brings benefit to society, will be far better at being able to innovate with using new technologies and data.
So ethical for you is about capturing and sharing data ethically. And how about you, Alex?
So that's a crazy panel. We speak about ethics and technology. And technology is about AI and robots. And sometimes I wonder how we are going to implement ethics for robots. I've been in healthcare for over 23 years, and in 2020 I established IGEA, taking from a deep belief that health data, our health data, belongs to us. So I would split the discussion into two areas. First of all, answering the question of who owns our health data. And this is a question that has two implications. First of all, for preventative care, because as long as we don't have access to our own health data, we are deprived of the right of continuously monitoring it, and thus to live the longest version of our life. And the second challenge is how we are contributing consciously with our health data for research. So the first question about who owns the data. But once the data is owned, is shared and let's say transparently used for innovation and for technology, the second question is how we make sure that technology is good for healthcare. And technology can be good as long as we control it, because if technology controls us, it's not going to be or to go well. In order to control, we need to understand. And to understand technology, we need two things. First of all, transparency. We need to know that we engage with an AI system and not a doctor. We need to differentiate between a machine and a human being. And the second thing that we need is very strict criteria when we release AI for public use. It's one thing to keep a technology in the lab, and there we can do theoretically anything, but it's a different story when we release it to the public. So summarizing, ethics is about answering questions of who owns the data. Second, how we make sure that we release to the public the right tools which are functioning perfectly. And third, how we make sure that all the time when humans engage with technology in healthcare, know that on the other side is a machine and not a human being.
So I believe we go to the consensus that everyone should own the data, and the usage of the data, the sharing of the data should be considered with the mindset of everyone. But can you just go deep dive into the real world use case, or the challenge or the positive impact that we can balance between the big data or AI in healthcare and the ethical usage of it? We go back from here because he talked about the data ownership. Do you have real use case that you are doing?
So I will share the US perspective. So until rather recently, so 2017, the only relevant regulation was HIPAA. But HIPAA is more focused on security and privacy. Still, in 2017, appeared the new legal framework, which is 21st Century Cures Act, or Cures Act in short. And the advancement starting from making sure that individuals take back control over their health data. This was the pure, let's say, message transmitted by the law when it was implemented. And it started to operate in October 2022, so 1 year ago, more or less. And there are, in Title 4 in this law, there are 4 main messages that are transmitted. First of all, we avoid any kind of blocking the access of the individual to the health data. So healthcare providers or insurers can no longer invent or use any kind of barriers to deny the access of the individual to the health data. The second thing is that they need to provide digital access, because it is considered that sharing the information on paper, as long as you already have the information in digital, is an unethical way to block the access. The third is to do it in a timely manner. You cannot prolong the release of the data to the individual over a certain period of time. There is no ethics in doing that. And the fourth is about interoperability. So when you share the information in a timely and digital manner, you need to make sure that that information can be plugged in by the individual in another system, in another healthcare provider, without any friction. So remember these 4 directions. And I believe, and probably my colleagues in the panel will dive in what's happening in the EU, because EHDS is trying to construct on the same pillars. So my message would be, if you want a new kind of architecture for the healthcare, it starts with empowering individuals to take back control of the health data.
My data, my right. That's the USA's view, and we have 2 representatives from the UK, so please continue.
Sure. So to answer your question about a use case, I can describe really briefly a great use case that we had recently that demonstrated the benefits of being able to combine data from different sources. So in Greater Manchester, the area that I'm currently in, we have a population health management solution where we were able to bring in not just health data, but also social care data, as well as other determinants of health, so such as household income, access to public services, and looking at all of that diverse, rich data set last winter, we were actually able to identify that the highest predictor of an individual or an individual from a family ending up in hospital because of being unwell was not their health risks or their comorbidities or how many medicines they take in that household, but actually their access to heating and fuel. So instead of investing our money in our clinical services or in our doctors or nurses, we actually provided people the equivalent money to put in fuel in their houses to be able to heat their house. And that was the greatest impact that we could have as a publicly funded healthcare system to reduce the burden on our healthcare services. So I thought that was a really, really beautiful example of how actually bringing data together from different sources, again, for the right reason, to provide benefit to patients and society, can be really, really impactful.
That's great example, and your example also in the UK?
Yes, so very quickly, I think from my point of view, so the owners of the data are the patients, and we're obliged to look after that data and consider the ethics of how we use that data. From an analytical point of view, having access to the data, the more data I can have access to, the better, the wider determinant data discussed there that Valletta said. But we also, under our governance rules, are told where you can only have so much of a data set. If we want to start using AI and predictive analytics, we need all the data. Don't ask me what data items I want. I don't know, because until I run an AI program or an algorithm, I don't know what might be important and what might be vital to the outcome and the insights and the intelligence we gain from that. So it's that fight on the secondary uses of being able to get access to everything rather than this restricted idea of you can only have this bit and this bit. We might be missing something vital. So the access to the whole data, and we have to bring the patients on board with why we're doing it and why we need it.
Yeah, it's quite interesting because we agree that it's my data, my right, but sometimes that the patient and the people do not even know what they have or what they are. The lawyer here, maybe you have another view.
Yeah, from the EU perspective, and as I won't have much time to elaborate, so I will try to point a challenge that the MedTech industry will face with the new regulation that is proposed in the EU. So we have two pieces of legislation. So we have the European Health Data Space that wants to give control to the people concerning their health data, but at the same time allow the research to use the health data. So data, as you know, is fundamental, and we have lots of data that will be useful if properly and ethically used. And the European Health Data Space will try to do that, namely by defining how secondary use may be done, namely for research, much better than the GDPR does at this stage. This is the first piece of legislation. On the other hand, we have the Artificial Intelligence Act that wants to bring transparency, bring a set of rules to the use of the artificial intelligence, namely when using data to health data sets to feed LLMs and feed AI systems. And the challenge that I would want to point is this. These two pieces of legislation, they are connected, and if a system, an AI system, qualifies as medical device, then it has to comply with MDR and has to comply with the AI Act. Now, the AI Act says if the MDR says that the system has to be assessed by a third party, then it automatically is an artificial intelligence high-risk system, okay? So the question here is that to know if it's a medical device or not, we have to know the intended purpose of the system, the intended purpose. So my question is, and the challenge that I give you is that what if we are talking about a general purpose AI in which we don't really have the intended purpose, the medical intended purpose, but we have the potential medical purpose? And I'm really curious to know how the law will deal with this. So if it will qualify as high risk and put it also in the MDR status and obligations.
Yeah, thank you. I really definitely agree with you that before implementing AI in any kind of application, we have to set the right purpose of this kind of algorithm, data set, and everything upfront. Because we are tight in time, so maybe one question from the audience. If there's no question, because I believe this is quite complex topic, each person here, please give me one sentence, takeaway message that people leave from here. Like, how do they balance between innovation and the responsibility? One sentence per person. Lady first, please.
I think that the takeaway is, and from the work I've done, is really, really engaging with the public and not forgetting the voluntary sectors as well and charitable organisations. They have such a rich knowledge of how best to take our insights and take our intelligence and help us drive forward into new systems, new innovations that will work for the people we're aimed at doing the good for. They need to be involved as well because they can help us decide, is that the best place to put our money? Will they use those services we put forward? So complete transparency and involvement with everyone.
Great. That's one paragraph, one sentence per person, please. Alex?
I'm often asked whether AI will replace doctors, and all the time I answer that doctors using AI will replace doctors not using AI. So the right answer to that is that we cannot stop technology. And it's important that we build a framework that ensures ethics use of AI.
Yeah. The framework goes last. Vidya?
Thanks. So for me, building on Jane's point, this is really, really hard, and not one person or one expertise can solve this. So in order to ethically innovate, we have to work as teams. So that includes healthcare professionals, technologists, ethicists, legal, and an entire diverse team is required to be able to do this safely, and absolutely having the patient's voice as part of that is absolutely critical.
Thank you. And conclude.
So thank you. The European Data Space and the AI Act are fundamental to protect data and to have an ethical use of data. And so I know that sometimes the EU takes time to do stuff, but it's good that they do it well, because then it's a role model for the world. So it's the Brussels effect, as happened with the GDPR, that EU developed and the rest of the world almost followed suit. And so I would say that my hope is that it is well done, and so afterwards the world will follow, and then we will have ethical use on this field that is really important.
That's it for today. So thank you so much for sharing your insightful on different countries, different industry. And we are actually 9 minutes behind. So thank you again, and we hope we can soon to achieve the equilibrium of the innovation and responsibility. Thank you so much.